Dear colleagues, I'm Dr. Prospado, Specialty Registrar, presenting a critical appraisal of a journal club academic meeting on an ecological study. This ecological study is on the incidence of schizophrenia in ethnic minorities in London, an ecological study into interactions with the environment. The outline of the presentation is the journal paper, the critical appraisal, discussions, and questions. The aim is this paper was to determine whether the incidence of schizophrenia among people from non-white ethnic minorities is greater in neighborhoods where they constitute a smaller proportion of the population. And it's an ecological study design, including retrospective study of case records to calculate the incidence of schizophrenia in the ethnic minority population across electoral wards, and multi-level analysis to examine interaction between individuals and environment. And the setting was in 15 electoral wards in Camberwell in South London. The inclusion criteria were participants, all people aged 16 years and over who had contact with psychiatric services during the period 1988 to 1997. The exclusion criteria, there was none identified. The outcome measure was incidence of schizophrenia according to research diagnostic criteria. And table 1 in this study showed the incidence and standardized incidence ratio of research diagnostic criteria for schizophrenia according to the operational checklist for psychotic disorders. And it shows the ward, the number of cases, the crude rate, adjusted rate, standardized incidence rates. Table 2 in this study showed the influence of explanatory variables on unadjusted and adjusted incidence rates. And it shows demographics of variables, age, sex, the non-white ethnic minority, neighborhood level, equivalent of individual level, the proportion of non-white ethnic minorities, and level of deprivation. Table 3 showed the change in incidence and incidence rates, ratios for research diagnostic criteria for schizophrenia. And it shows the proportion of non-white ethnic minorities, the incidence per 100,000, unadjusted ratio of 95% confidence interval, and adjusted ratio 95% confidence interval. The results, the first onset cases of schizophrenia in men was 57% and women 43%, with a mean age of 35.4 and ethnicity of non-whites 57% and whites 43%. The incidence of schizophrenia in non-white ethnic minorities increased significantly as the proportion of such minorities in the local population fell. The results also showed the incidence rate ratio varied in a dose-response fashion from 2.38 95% confidence interval of 1.49 to 3.79 in the third of wards where non-white ethnic minorities formed the largest population of 28 to 57% of the local population. It fell to 4.4 in the third of wards where they formed the smallest proportion of 8 to 22%. In conclusion, from this study, the incidence of schizophrenia in non-white ethnic minorities in London is greater when they comprise a smaller proportion of the local population. Statistical analysis with the research diagnostic criteria to standardize rates of schizophrenia and stratifying for age, sex, ethnic minority using the procedure ISTD IZE procedure in the Strata Statistical program. Now on critical appraisal discussions, was ecological study the best method of carrying out this type of study? And what are the strengths of this type of study? The strengths are that it's cheaper because there's reliance on data previously collected and easier to obtain data at population level, and there's also wider range of exposures ascertained, and also analysis and presentation is simpler, and the public health impact of association at the incidence rate level could be ascertained. What are the weaknesses of this type of study? The weakness: estimated effect at ecological level is not the same as individual level, and also only if data sources exist before then one can analyze them, and it depends on quality of existing data and the accuracy. They are also confounders and retrospective in nature, so it's prone to bias and various types of biases: ascertainment, selection bias, and recall bias. Inclusion and exclusion criteria. The question is, were inclusion and exclusion criteria clearly defined? Well, inclusion criteria: the participants, all people aged 16 years and over who had contact with psychiatric services during 1988 to 1997. Exclusion criteria: children and older adults. What is a confounder? It's a variable that is related to the exposure that is independent variable and is an independent risk factor for the outcome of the study, which is the dependent variable. Example: smoking cigarettes associated with higher risk of schizophrenia. The confounder is smoking cannabis, which is related to cigarette and is an independent factor that affects schizophrenia. Ecological fallacy. What is an ecological fallacy? Incorrect conclusions about associations in ecological studies. Associations at population level do not necessarily hold at individual level. Study designs. What are the types of study designs? These are descriptive studies. Characteristics is that there's no control. Analytical studies compare two groups, example in a case control. Experimental studies are used to assess causality and effect, example randomized control study. And secondary research summarizes results from different studies, example systematic review and meta-analysis. Outcome measure. How was the assessment of outcome measured in this study? Incidence of schizophrenia according to research diagnostic criteria. This was the outcome measure. Application of this study. Can the results of this study be applied to local population? Incidence rates of schizophrenia are inversely proportional to the population density of ethnic minority groups. These are of great interest, and it has major implications for the understanding of the mental health of ethnic minority population and the mental health service provision. It's crucial that the interplay between complex social factors should undergo rigorous sociological analysis and results not generalized but interpreted with caution, as they have the potential to be manipulated as a political tool. For example, the display of and displacement of refugee populations. Some questions. 1. One of the following carries maximum weight in the hierarchy of evidence for research studies. Is it randomized control trial, cohort study, case control study, meta-analysis, or case reports? What do you think? Meta-analysis is the answer. The second question, ecological study, what does it mean? It's a type of study of whole populations rather than individuals, and often uses computerized databases. Analytical study design. One of the following is analytical study design: ecological study, case study, observational study, financial outcome study, and ADL analysis. That's activities of daily living analysis. What do you think? Ecological study is an analytical study. P-value. Statistically significant p-value is, which of them? One is right. Less than 1 in 40, less than 1 in 20, less than 1 in 200, less than 1 in 10, less than 1 in 100. What do you think? Less than 1 in 20. Thank you for your attention. Bye.